So in this part of the video, I'm going to be talking to you about antihistamines. If you're a hay fever sufferer, you're almost certainly taking these already, but perhaps I can give you a few extra tips. There's probably three main things that I want to say about them. So number one is it doesn't really matter which antihistamine you take. We do have a division between the old antihistamines, which had a sedative effect, and the newer antihistamines, which don't have a sedative effect. But to be honest, it's quite hard to get a hold of the old sedating antihistamines these days. Almost all of them that you find are the newer ones. So this includes loratadine, cetirizine and fexofenadine. Fexofenadine seems to have acquired this slightly magical reputation of being the best antihistamine. Not quite sure where that comes from exactly. So we do get a lot of calls into the surgery asking for fexofenadine to be prescribed. But in fact, there are studies that show that cetirizine and fexofenadine are no different, and in some studies, cetirizine actually outperforms fexofenadine. So there's no need to ask for fexofenadine in particular. If you do really want it and you just feel that it works for you, it is actually available over the counter. Point number two is that it is worth taking these medications every day. So if you take an antihistamine, it does usually get into your bloodstream within about an hour or so. But if you take it on a regular basis every day, the levels do slightly build up in your bloodstream, and this probably takes about 2 or 3 days to happen. If you take them ad hoc, just when you feel that the hay fever symptoms are coming on, or if the pollen count is particularly bad, you may not get as much benefit from them as you would do if you were taking them every single day. So number three is a question that I get asked a lot, and that is, how safe is it to take more than one tablet a day? This is not something that we're really supposed to do, but a lot of hay fever sufferers get a bit desperate. Sometimes they find that by the end of the day, the symptoms are starting to come back a little bit, and they're often tempted to take a second tablet on top. There is probably some truth to this. So some people do metabolize the tablets a bit faster, and so you may find that by the end of the day, the tablets are beginning to wear off because the drug levels in your bloodstream have dipped. I will start off by saying that this is an unlicensed dose, so if you take anything more than one tablet per 24 hours, the manufacturer will not take any responsibility for any side effects or problems that occur. How safe is it really? Well, we do actually use higher than licensed doses of antihistamine for certain conditions. So notably, chronic urticaria is a dermatological condition with a lot of rashes and hives, where we do use up to even 4 tablets of antihistamine a day. And it does seem to be safe to do so in the sense that it's not going to cause any lasting damage to your body or any organs. So you may have an increased number of side effects. But unlike something like paracetamol, where if you were to take a double dose for a few days, you would definitely be causing your liver some damage, taking a higher dose of antihistamines is probably not going to do you any harm. Now, I won't go so far as to actually recommend it, because there are no studies that show that it's effective to do so. But you can probably rest assured that if you have done so in the past, you haven't done yourself any major harm. The next part of this video is going to be on mast cell stabilisers. I'm not sure what a mast cell stabiliser is. All I mean is this, which is the Optrex brand eye drops. The active ingredient here is 2% sodium chromoglycate, and this can help if you have allergic conjunctivitis, if you get very puffy eyes, itchy eyes. These can be really helpful on top. And it is fine to use antihistamines, a nasal steroid, and these types of drops all together at the same time. It's perfectly safe to do so. These can be put into your eyes up to 4 times a day. The nasal steroid that I mentioned in the previous video, there is actually efficacy in conjunctivitis as well as rhinitis. So if you get eye symptoms, it is still worth using a nasal steroid, because some of that steroid travels up the tear duct into your eye and reduces the immune system response over there. Sodium chromoglycate is available as a nasal spray in many countries, but I've never seen it on sale as a nasal spray in the UK. I don't know why exactly. And so if I'm having a particularly bad day with rhinitis, with nasal symptoms, I'll sometimes just lean my head back and put a couple of drops in each nostril, and that's perfectly safe to take. Again, that's an unlicensed way of using it, but it's not going to do you any harm.